It's great to have you all here. And we're going to spend a little bit of time talking about the America's Essential Hospitals Fellows Program, which is a signature program that we've had for years, and which has helped us to cultivate membership in the safety net across America. I'm Bruce Siegel. I have the pleasure of being the CEO of America's Essential Hospitals, and with me is Dr. David Engler, who is our Senior Vice President for Leadership and Innovation, and who recently joined us, we're grateful, from the Ohio Hospital Association's Quality Institute, where he spent some years in the trenches on this work. Let me talk a little bit about us before David really takes over. We were formerly known as the National Association of Public Hospitals and Health Systems, and that's how you probably knew us before. We changed our name back in June, and we did it really for two reasons. We changed to America's Essential Hospitals because our membership was changing in terms of its diversity. And we had increasingly hospitals who were private nonprofits, but who were not public hospitals in our membership, but who cared about some of the same issues that we care about. And I'll spend just a second talking about that. We also changed our name because of the changes in healthcare, the Affordable Care Act, and everything else. We wanted to send a very strong message that there are hospitals in America who are very much doing things that are very critical to the health of communities, and that who are truly essential and require those community support in some way or another. We wanted to make that message very crystal clear. Our association started back in 1981. We now have more than 200 members. We are Washington, D.C. based. We champion for hospitals who really care for the most vulnerable, who care about that mission and care about the issues that really impact that mission, whether it's Medicaid, whether it's readmissions penalties, whether it's how to really build high-performing systems that can really manage superutilizers. Give you a sense of our membership, here in Chicago, Cook County would be a member, as would be the University of Illinois Chicago. Some of the members who've been presenting here in this conference who are in our membership are places like Henry Ford Health System, also University of Utah, et cetera. So you get a sense of sort of who we are and our diversity. Our hospitals tend to be large, complex places. They tend to be often the burn center, the trauma center. They are almost all teaching hospitals. They are very complex organizations. They often have large, sometimes immense ambulatory networks. So Grady Health System, for instance, I think in Atlanta, has over, 1 million outpatient visits per year in their ambulatory network, their network of patient-centered medical homes across Atlanta. Our membership also, they tend to be large, as I mentioned, about 21,000 discharges. Why did we get into the leadership area? I think there's one important reason. Most of our health systems, they have very specific needs, and I've laid that out to a certain extent, but also they tend to be one hospital, two hospital, three hospital systems. They often don't have the resources, the infrastructure to create some of the wonderful programs we may have seen here today. And instead they turn to us, as sort of their association, to sort of create that as sort of an essential resource and to build the things that they perhaps could not have built themselves. I'll talk a little bit about the Essential Hospitals Institute. That is our 501c3 research arm through which the Fellows Program is done. It is really very heavily invested in this area of leadership development. It's also become increasingly invested in the area of quality and transformation of our systems. That has an interesting little history. Back in 2010, after the passage of the Affordable Care Act, our board got together as part of the strategic planning process, and frankly, before I worked there, and said, the ACA, which our association really, really supported very strongly, poses both challenges and opportunities for the safety net. Challenges because of value-based purchasing, challenge because of new competitive pressures that are going to be unleashed by Medicaid expansion and the exchanges, but also great opportunities because really in many ways ACA is based upon empowering the patients who have been our patients for so many years and really now perhaps provides the vehicle and the resources in which we can make sure they have the best care always, have disparities-free care, have equitable care. And so both the challenges and the opportunities really motivated us. They led to the creation of a transformation center in which the Fellows Program is housed. And we actually went to work in fundraising for that center. We've raised millions of dollars in external funding to actually accomplish this mission and to help our members transform. And a lot of this, frankly, was due to a seed grant a considerable seed grant from the Kaiser Permanente Community Benefit Fund. So when Ben Chu's system performs, we're very happy, because then he has a bottom line and we can get some of that money too. So thank you, Ben. Much appreciated. So with that said, I'll give you just a brief primer. That's our association. Our supporting foundation through which this work is done is the Essential Hospitals Institute, and then we have a transformation center in the institute, as well as a research center as well, which we'll perhaps talk about at some other time. So at this point, let me turn it over to Dr. David Engler. David?
Thank you very much, Bruce. So let me introduce you to some of the 42 fellows that make up the class of 2014. These individuals have been selected by CEOs and top leadership positions throughout the country to go on a year-long journey with us in the development as leaders. Leaders that will run America's essential hospitals in the future. Leaders like Pauline Grant, CEO of Broward Health Center and Fellows Class of 2003. Leaders such as Carol Gomez, Chief Operating Officer at Stony Brook University Hospital and a member of our Fellows Class in 2010. America's Essential Hospitals has operated the Fellows Program since around 1986, and it's been our goal throughout the process and throughout the years of developing capacity within our member hospitals. Our goal has stayed the same, though, throughout the years, even though our themes have changed with changing times in healthcare. And basically what we're after is to increase the effectiveness of our fellows in their hospitals to create better patient and better organizational outcomes. And we have our own triple aim, if you will. And the triple aim of the Fellows Program is, first of all, to build knowledge and to build passion around becoming a leader in a high-performing organization. Our second aim is really to help our fellows identify where their strengths, their leadership gaps are, and their performance gaps are within their hospitals, so that they can go back to their organizations and strengthen and use leadership skills to transform those organizations into high-performing organizations. I've been asked to talk just a little bit about the program's benefits and features. First of all, the theme for each year's Fellows Program is chosen by our Education Committee and then acted upon by the Board of Trustees of the organization. Each fellow is nominated by a CEO sponsor to participate in the Fellows Program over a year, and they have very close interaction over time with that CEO sponsor. Most importantly, our fellows try to work in teams with other fellows in the program so that they can develop a project that supports an organizational mission, vision, or value that's been assigned to them by their CEO. So the CEO and the organization gets back in return for giving us, the fellows for the year, an organizational objective, a mission, and a project that results in change, transformational change at the organization. We base our program on subscription fees. They modestly cover some of our direct costs, not all of the cost of the program, and our staff supports it. There's myself, a project management, and a series of consultants that we have called in to help our program. Most importantly, I'm asked a lot of times about how well the fellows are able to integrate and network with other fellows throughout the country. And since 1985, we've had over 500 fellows come through America's Essential Hospitals. Over 500 individuals have been trained by America's Essential Hospitals in this capacity building program from over 90 different organizations throughout the country. And this is the spread of those organizations. I'm also asked, well, what is the demographic breakdown? What do fellows look like? Where do they come? A male and female breakdown. Most importantly on this slide, you'll see that most of our fellows are clinicians, physicians and nurses, with about 60% of our average fellows class coming from clinical specialties and 40% coming from administrative positions, mostly directors and above, sometimes vice presidents, et cetera. But this is the breakdown on both sides. The clinical side is about 60% docs and about 40% RNs. This is the heart of the program. There are 6, and this is very important, there are 6 integrated components to our fellows program. Each of the fellows goes through a year-long process. We have 3 2.5-day on-site visits where all the didactic work is being done, leadership skills and leadership training goes on. But we tie those leadership skills and those trainings into site visits at one of our institutions. And the site visits are scheduled so that they coincide with the Fellows Program and that they coincide with the theme of that particular session. For instance, next year we will be taking our Fellows Program to UCLA, Harbor UCLA, where the CEO is very vested and very much involved in transparency as a change agent within the organization. So the Fellows theme during that session will be around transparency and how one can motivate their staff through the use of transparency in their organization. So we go on site visits. Networking, as I mentioned, is extremely important because over time the fellows really do depend upon each other for future work. And they get together and they call each other. We also have some receptions, et cetera, every once in a while at our annual conferences. Each of the fellows goes through surveys, and we use 2 different surveys. Mentioned before that we use Myers-Briggs as a way of teaching fellows how to manage themselves as well as manage other folks. And we do an LQUAT survey at the organization to identify gaps in performance and gaps perhaps in communication that might exist within their own organization to support their quality improvement strategies. So those 3 things are related to each other. Most importantly, we have group webinars that are scheduled. We have 4 during the year in between the particular in-person workshops. And then finally, as a result of the Fellows Program, each fellow devises their own project that's going to support an organizational initiative at their hospital. We spend a lot of time working and developing projects and statements around what the project is going to accomplish. And here are some fellows meeting to discuss what their project is and how they're going to work on it collectively. A number of people have asked me, what sort of projects do they engage in? Well, they range from all sorts of process engineering programs and projects to reduce readmissions. There's a heavy focus, as you'll see, on some of these examples with respect to quality. Improving HCAP scores across physician groups in particular is always a very interesting project, and a number of our fellows have engaged in it, as well as balancing cost and quality to get at the value equation that we've talked about here earlier, and process reengineering and reducing such things as nosocomial infections and iatrogenic infections within inside the organization. So how do we know that we've been effective? Well, our purpose is really to train future leaders. Our purpose is to retain and recruit members. And while we don't talk a lot about it, really what the Fellows Program has been able to help us with is the engagement of our member hospitals and engagement at the CEO level within our organizations. And I'll show you in a few minutes that many of our fellows have become leaders in our national organization, which has proven to be very beneficial as an organization, as an association, which is based upon membership involvement. We looked at the last few years, and this is kind of a very interesting statistic when I was preparing the speech, so I really thank you very much for inviting us today because it resulted in us looking back at the last few years. And when you look back at the last 5 years in particular, 15 of the fellows in the last 5 years have come up to the C-suites in our hospitals. And 5 of those 15 have become CEOs of America's essential hospitals. It's a very telling story and a very good result from our fellows program that started off in the development of capacity and that led to future development and future leaders within our organization. Finally, or at least when we're talking about the ability to retain and recruit future members, we use our fellows now these days as faculty inside of our programs so that the members, the current fellows, get to hear from past fellows. How was your experience? What did you learn? What were the barriers to your education to becoming a leader in your organization? What did you find out through the Fellows Program? What did you discover about yourself and others that made you a good leader. So faculty members are now joining us from former fellows. We're putting them on the faculty to share that wisdom with other fellows in the program. We're engaging new members. It's part of a very deliberate part and parcel of a very deliberate program to recruit new members, to engage new members in our activities, and to work with new members in the Fellows Program so that they become part and parcel of our national organization. The Fellows have become very involved with America's Essential Hospitals. These two fellows, one on the left and one on the right, Kirk Calhoun on the left, was in the class of both 1989 and the class of 2001. He liked the class so much he took it twice. And Dr. Calhoun has later on became the chair of our board in 2010. Janice Spiso on the right is currently secretary of our board, and she has served very well in that capacity. So not only are our fellows are becoming members and CEOs of our organization, but they're also becoming national leaders at America's Essential Hospitals. Don't want to leave without talking a little bit about our CEO sponsors. As you recall, we provide sponsorships for each one of our fellows, and they interact on a very regular basis with CEOs and their sponsors at their hospital or at their system. We send out a sponsor newsletter so the sponsors are familiar with everything that we are doing in the Fellows Program, and they are involved with their fellows throughout the program. We also ask our sponsors for input into the curriculum. Are we hitting the right marks as we go along in our Fellows Program? Is there something that we are missing? Next year, we will be doing work with adaptive leadership, and have chosen adaptive leadership as a new theme for the program, based upon the input that we're getting from both the board, the education committee, as well as the CEO sponsors, that is the way of preparing future leaders for future change in a changing healthcare environment. And finally, as I mentioned, we're also having our fellows, our past fellows, serve as faculty members for the Fellows Program. Now, we're not really quite sure, we can't really pinpoint the fact that why our fellows have turned into CEOs, and we can't necessarily say that because you're in a Fellows Program, you're going to become a CEO. We can't say that with any certainty, but I believe that we know where they started from, and they started from the Fellows Program in America's Essential Hospitals. I want to thank you very much for your time and effort today. We have some time for some questions. Yes, sir.
Of the 15 fellows that found their way into the C-suite and 5 into the office of the CEO, what was the mix of clinical and non-clinical background?
It was half and half, just as the Fellows Program represents about 50% clinicians and 50% administrators. It was half and half on that side. Good question.
And if I could just add to that a little bit, I'd point to two things, I think, in some of those numbers and faces. One is our sense is that the Fellows Program may be successful in grooming talent, especially among women, when we've known that's been an obstacle in terms of mentorship and in terms of promoting to leadership. So when you see people like Janice Spiso, who's now head of the University of Washington Health System, or Sue Curran at San Francisco General, women leaders, nurse leaders who have been able to get to the chief executive officer suite in a time when that's somewhat difficult. So I think why it is that we may have been successful in that, not sure, but I think it's probably not something that is you see very often and a challenge many of us have.
Good question. Yes.
Hi, great talk.
Thank you.
What was the strategic imperative that led you to go on this journey in 1985 or shortly before you started? And second question, is this program, are people eligible for it? Do they need to be a professional in these organizations, or does it include technical and clerical staff, et cetera?
I'll let Bruce.
So the strategic imperative back in 1986 for me was just trying to finish medical school. So I can't speak to what the organization's imperative was back then, but I can speculate on it a little bit because neither of us were there. My sense is even more so back then, our membership, which was even more so back then, very focused on truly public inner city hospitals, really desperately needed a resource that no one else was providing at the time. To really groom, to really develop talent and leadership, and to really, move people, not necessarily move people up, but to help these organizations compete in a very difficult environment. So my sense is that was the imperative. The program is actually aimed towards higher level, I'd say, middle to higher level people in management or other fields, not more junior fields. And the tuition, I think, is, David, like a little over $6,000 currently.
Yeah, $6,500 a year.
Yeah, so it's not a trivial investment on the part of the organization to send people, but even more so is the time, because it really is a true time commitment.
Thank you. Yes.
Very impressive program in terms of fellowship. Are you at a point where you can determine how effective those 5 CEOs are? I understand that they've gotten to the place, but what are they doing? And is that having an effect in terms of the improved performance of the organization?
I can answer that question a number of ways. I can answer the question from a standpoint of the CEO that's at Harbor UCLA now. And really, his journey through the Fellows Program made him very aware of the impact of motivation of his staff and how best to crystallize and motivate his employees, and in particular his frontline workers. And when he went through the program, and we've talked with him subsequently, he decided what he was going to do is he was going to put a face on harm at his organization. Now, a lot of people have been talking about that, but Delvecchio Finley did it. And how he did it was he put the thumbprints of individuals that were harmed at his hospital, that may have gotten a CAUTI, might have gotten a CLAPSI, might have gotten an error in medication administration, and started putting those thumbprints in the hallways of his institution. He came to the realization that what he needed to do was put a face on the issue of harm. These were not about control charts. These were not about demographics. These were not about process improvement pieces. These were real people that we had harmed. And I think he came to that realization by understanding that leaders change things. Leaders make things happen within their organization, and he wanted to make that shift. And I think it's partially due to the kind of training and the venue that he operated in and the support that he heard through America's Essential Hospitals.